Thank you very much for those member statements. We'll now get ourselves ready to move on to oral questions put by members to ministers. We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you very much, Mr. Speaker. Earlier this week, a CRA poll revealed that nearly 1/2 of women in Nova Scotia reported having been sexually harassed, and I can table that. The likelihood of experiencing sexual harassment in Nova Scotia is higher than that of Atlantic Canada overall. 26% of residents overall and 41% of women. Yet, the budget did not specify funding to tackle this all-too-common problem, even with a budget surplus. So why isn't combating sexual harassment a priority for this Premier and his government?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. It is completely unacceptable, Mr. Speaker, with the report and the numbers that we're hearing coming out of our province. Is why we've continued to invest as a government in a sexual assault strategy, working with our partners across the province. It's why, Mr. Speaker, as you know, the Human Rights Commission has a program, of course, to support. And why workplaces across this province need to continue to make sure that they have in place a sexual assault strategy. We need to make sure that every Nova Scotian feels safe in their workplace, Mr. Speaker, and we're going to continue to work with our partners to ensure that women across this province can go to work and feel safe in their workplace. And at the same time, Mr. Speaker, we need to ensure that women and young girls feel safe in their own homes. Quite frankly, it's unacceptable at the level of domestic abuse that takes place in this province. We'll continue when we all work together to ensure that we continue to work to eliminate it.
The Honourable Leader of the Official Opposition.
There was no new funding is the point, though, and community groups that support survivors of sexual violence in Nova Scotia say they'll likely have to turn away people without an extension of funding for the sexual violence strategy. The funding was $2 million per year. One advocate argued that this is unethical for the province not to offer long-term solutions, especially because more victims are now coming forward, and I will table that. Despite all of this, the $2 million earmarked in the budget will be spread between domestic violence and sexual assault. No matter how you look at it, that means less money for sexual violence services. Does the Premier agree with advocates on the front line that denying them predictable, long-term funding is unethical?
The Honourable Premier.
Mr. Speaker, this is a very serious issue the Honourable Member brings to the floor. Ratcheting up the conversation, Mr. Speaker, is unhelpful for those women across this province who require those support. While we're continuing to make sure, Mr. Speaker, in our budget that we continue to make those investments, working with our partners, Mr. Speaker, to continue to ensure that young women across this province, that women who are living in domestic violence get the support they require, to ensure that those who suffer from sexual assaults, Mr. Speaker, get the supports in and around them. We're working with the Human Rights Commission. We're working with shelters across the province to continue to make sure we make those investments to ensure that people feel safe, and it's incumbent on all of us. It's incumbent on all of us, Mr. Speaker, to make sure that we conduct ourselves in our workplace in an appropriate way so that women feel safe to go to work in this province, Mr. Speaker, and I would encourage all of us, be mindful of what we say and how we conduct ourselves in this place and other places when it comes to ensure that all of us feel safe at workplace.
The Honourable Leader of the Official Opposition.
Mr. Speaker, I'm just trying to draw awareness to something that's hugely an impact on this province. And when staff provided the Standing Committee on Community Services an update on the sexual violence strategy in December, they indicated that they had done public polling to better understand the public awareness, attitudes and perceptions regarding sexual violence in our province. The polling found that there were no statistically significant differences between the two survey points, just 1 year apart. The explanation given was that it takes time to make societal change. And I'll table that, Mr. Speaker. Why has the government split the funding for sexual violence services, much needed societal change, before it has been accomplished?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. I want to draw her attention, Mr. Speaker, to $755,000, Mr. Speaker, an annual investment in Department of Community Services. $385,000 of historic discretionary grant that goes to Avalon Sexual Assault Centre and the Colchester Sexual Assault Centre, Mr. Speaker. I want to draw her attention, Mr. Speaker, to $90,000 from federal funding that's part of this. There's $1.3 million, over $1.3 million that our government invests in the same program, Mr. Speaker, to ensure that programs are across the province. That's a total. There's $832,000, Mr. Speaker, to provide for 4 organizations: the Avalons, the Antigonish, Colchester, and the New Starts, Mr. Speaker. And furthermore, there's an additional $2 million to ensure that we continue to eradicate domestic violence in this province.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, I would like to table an interview this week with Dr. Margaret Fraser in Sydney, who said that emergency room patients are not getting proper care because no beds at all are available when they come in. When they were asked to comment, the health authority blamed the shortage of beds on an influx of patients at certain times of the year. Dr. Fraser, however, says the problem is not the time of year, but that there aren't any beds available in any of the 4 hospitals in the CBRM, so that the regional emergency department itself is having to function as a ward, something which, in her words, they are ill-equipped to do. So I want to ask the Premier if Dr. Fraser's view of this doesn't make basic common sense to him.
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable for the question. I want to thank all the citizens across the province who continue to work day in and day out to ensure that Nova Scotia have access to primary health care and emergency health care. As I said to the Honourable Member at each question period, he raises this issue. We continue to reduce the wait list. Now it's been reduced by 53% since we've come into government. We've invested in home care in every one of our budgets to ensure that seniors who tell us they want to have that care at home, Mr. Speaker, we're providing that care at home. We're going to continue to work with our partners to make those investments. And as we go through this process, if it's deemed that we need to build more long-term care beds, we will do so.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, I want to return to Dr. Fraser's analysis. She also noted that the conditions in the emergency room at the Cape Breton Regional are, besides being uncomfortable for patients, they're dangerous for staff. In fact, in Dr. Fraser's estimate, treating people in hospital corridors is untenable. It's not a practice that allows doctors to properly perform exams on patients, and it shouldn't be continued. So I want to ask the Premier, Mr. Speaker, will he concede that Dr. Fraser here has a reasonable and a considered point? The
Honourable Premier.
Mr. Speaker, of course, we will agree that Dr. Fraser, if there's issues at the hospital that she's bringing forward, we'll continue to investigate those to work with her to ensure not only that she, but all healthcare providers have the appropriate environment to be providing the care Nova Scotians expect.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, we heard from a doctor this week who, like many physicians in this discussion, wishes to remain anonymous, who said that they would gladly give up their last 5 years of raises as a general practitioner if they could get their patients timely access to psychiatry and other specialists, decent home care that meets their needs, and the doctor said, timely access to long-term care. The physician's view was that family doctors won't stay here if there aren't adequate resources to support their work. Mr. Speaker, I want to ask the Premier why he won't acknowledge the reasonable truth that's being spoken here, that not opening up new nursing homes doesn't help us at all when it comes to retaining doctors.
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for his litany of issues that he was talking about. I want to speak directly about home care. We've invested in every budget. We've eliminated the wait list in many cases. Talks about the long-term care beds, Mr. Speaker. We've reduced that wait list by 53%. He's talking about the length of time they stay in hospital, Mr. Speaker. We've reduced that by almost 50%. We're continuing to work with patients across our province to ensure that they get the timely care that they want in provinces across the province. As I said to him, we're listening to people across this province who will work with our healthcare providers, the clinicians he spoke to. The Minister of Health is working with them to ensure that we have the appropriate number, the right salaries across our province, that will continue to invest in the health of Nova Scotians.
The Honourable Leader of the Official Opposition.
Mr. Speaker, the Nova Scotia Lobbyists Registry was created in 2002. It was designed so that Nova Scotians could know who was meeting with government officials. Wednesday, the Premier met with former Prime Minister Jean Chrétien, and Mr. Chrétien is actually working with the Sydney Harbour Investment Partners to help establish a container terminal. Mr. Chrétien stated he would be seeking provincial investment in this project, a clear act of obviously lobbying under the Lobbyist Registration Act, and I will table that document, and nice picture too. Did the Premier know that Mr. Chrétien was not a registered lobbyist when he agreed to meet him?
The Honourable Premier.
Mr. Speaker, that would be up to Mr. Chrétien if he deemed to be whether he's to register as a lobbyist. I do want to say on behalf of our government, I believe indeed all Nova Scotians, how grateful I am not only for Prime Minister Chrétien, Prime Minister Mulroney, others who've responded to my call when I've asked them to work on behalf of this province, when I require support in whether it's in Washington or whether it's in the New England states or whether I'm looking for meetings with top business people. Those prime ministers have responded to my call each and every time, and I want to assure all members of this House, the same as I've told the media outside of this House, if a former prime minister calls my office, I will take the call. If a former premier of this country calls my office, I will take their call and I will meet with them, because I'm going to tell you each and every time they respond to the needs of Nova Scotians when I ask them.
The Honourable Leader of the Official Opposition.
Look, Mr. Speaker, I sincerely and honestly don't want to be unreasonable here. I understand that the situation the Premier is in, and if a former Prime Minister reaches out, courtesy demands that he should take the offer and meet him. But Mr. Chrétien had clearly signalled the intent of this meeting. At an event in Sydney earlier this week, the Premier had to know what Mr. Chrétien wanted to talk about. Rules are rules, Mr. Speaker, and if the Premier is going to meet with a lobbyist, that lobbyist should be on the registry. It took someone with that type of profile of a former Prime Minister to shine light on this. So can the Premier detail the actual process used by his office to ensure that lobbyists he meets with are in compliance with the Act and regulations?
The Honourable Premier.
Mr. Speaker, it is incumbent on Mr. Chrétien or anyone else who wants to meet with the Premier, if they deem themselves a lobbyist, to register. It is not up to me, Mr. Speaker, but I do want to respond to the fact she's absolutely right. Mr. Chrétien was very clear in the paper. He supported that project in Sydney. Not all members of your caucus do. I appreciate that. But Mr. Chrétien is very clear and out there and said he supported it. But he did not ask me for a single nickel. He just said it would be a good project for the province. He did not ask the provincial government to be part of it. There's been no money. I also talked about, quite frankly, if she wants to know the entire meeting, I also talked about the fact what it's like to be the 12th of 17. He's 18 of 19. We talked about what it's like to come from big families, the support you receive from them, and particularly when you run for public office, it's very difficult. I look forward to continuing my friendship with Mr. Chrétien in the years to come.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Mr. Speaker, my question is for the Minister of Labour and Advanced Education. Details came out this week of David Dingwall's contract to be president of Cape Breton University, and he'll be getting up to $310,000 in annual payments and thousands more in one-time payments. I'll table that, Mr. Speaker. And that is the equivalency of approximately 9 years of annual income for many Nova Scotians. So apparently the Memorandum of Understanding that the Minister negotiates with universities is what allows for these huge compensation deals. So my question is, I'd be curious to know if the Minister believes that in these days of growing inequality, sky-high tuition and young graduates loaded with debt, if this amount of compensation is really justified.
The Honourable Minister of Labour and Advanced Education.
Mr. Speaker, I'd like to thank the member for the question. Mr. Speaker, the member brought up two issues. One was debt on our students, and I would like to point the member and all members in the House to what this government has done, which is allowed loan forgiveness for every student who gets a Nova Scotia student loan in the province. Mr. Speaker, that's $6,800 over 5 years, fully forgiven upon graduation. Mr. Speaker, I'd also like to point out to the member that any decisions that come to compensation at a university are board decisions. So if she has an issue with any part of that compensation package, she can send her question to the board.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Well, that was an interesting answer. First of all, I had a meeting with several of the students' federations, and they're not satisfied with that package he's talking about. They need money up front because a lot of them are eating out of food banks. Mr. Speaker, in addition to the hundreds of thousands of dollars going from students' pockets to David Dingwall's pockets, students will also have to pay Mr. Dingwall's full salary for an entire year after he's stopped working for them. And that's something that the current Minister of Community Services called unacceptable a year and a half ago when she was Minister of Advanced Education and vowed to put an end to the practice. And I will table that, Mr. Speaker. So my question to the Minister is, what reason does he possibly have for continuing with this practice when so many students are struggling?
The Honourable Minister of Labour and Advanced Education.
Mr. Speaker, students were struggling under the NDP government because they couldn't find a job in this province. What we've seen in the last 2 years is we're retaining more youth in the province upon graduation than are leaving. Mr. Speaker, I'll remind the member, while they were cutting 10% from university budgets, 10 full %, we've been adding every single year.
Order, please. The Honourable Minister of Labour has the floor.
Mr. Speaker, I'll also remind the member that under this government, we have full loan forgiveness of Nova Scotia student loan to any university student. Under this government, university students have gotten...
Order, please. The Honourable Minister of Labour.
Maybe the member from Pictou West would like to stand up and ask questions as Pictou East, as opposed to interrupting constantly in the House, Mr. Speaker. Mr. Speaker, as I've said many times...
Order, please. The Honourable Minister of Labour.
Mr. Speaker, as I've said many times, decisions of compensation at universities, in my opinion, are board decisions. If the government was going to get in and start running the universities, we'd have to take them all over, and that's not going to happen.
The Honourable Member for Pictou Centre.
My question is for the Minister of Communities, Culture and Heritage. Mr. Speaker, during my former career, I quickly learned the importance of libraries play in the development of our children. They offered that quiet place for students to study and complete their assignments. They have also adapted with the times and have proven to be an essential piece of infrastructure in communities regardless of where you live in Nova Scotia. Many of these facilities across this province are experiencing service problems due to budget constraints. The Pictou-Antigonish Regional Library, as one example, continues to make difficult decisions with their staff hours, daily operational hours and services they can provide. All of this comes at the expense of those who need and require these services being offered. Question to the Minister, will the Minister commit to reviewing the core funding model for public libraries during this current year?
The Honourable Minister of Communities, Culture and Heritage.
Thank you, Mr. Speaker, and 2 former educators will get this House settled down this morning, help you out. Thank you so much for the question. It's a really important question because libraries in our province are going through a real renaissance, offering tremendous array of services to their communities. And the member is exactly right. We need to review the core funding model. We have a team of librarians from across the province working with the department, and during, in fact, this spring, we'll have a proposal coming from that committee for future funding model.
The Honourable Member for Pictou Centre.
I must admit, Mr. Speaker, and the former member over there and myself, when we were in the classroom, it certainly was a renaissance. Anyway, Mr. Speaker, it's a shame, Mr. Speaker, that it's been approximately 8 years since this public libraries across the province have received any significant funding. Libraries offer a place where people can go to access the internet, print off job resumes, email family and friends. I commend the staff at Pictou-Antigonish Regional Library for providing my constituents the ability to access these services, as well as offering a wider range of services such as toddler programs, technology training, and guest lectures. What I just described is not unique just to my area, but across our province. It is unfortunate that we can't meet the demand based on the current government funding. My question to the Minister, will the Minister commit to Nova Scotians that during this fiscal year, there will be an increase in funding for Nova Scotia Public Library.
The Honourable Minister of Communities, Culture and Heritage.
Thank you, Mr. Speaker. And I thank the member for raising this important issue. Libraries have become welcoming hubs, community centres, playing a pivotal role, especially with new immigrants and seniors in our communities, to help them navigate the digital world in particular. So we have a high regard for their work, and to that end, before the end of fiscal 17 and 18, we gave libraries across the province, all 9 regional libraries, $52,000 each, to make sure that they're providing an adequate array of services for their citizens, Mr. Speaker.
The honourable member for Kings North.
Mr. Speaker, my question is for the Minister of Education. Mr. Speaker, on March 9, 2018, the Minister announced 130 additional pre-primary classrooms. The Minister said it was the government's intention was to always deliver pre-primary in schools, but when space was an issue, partnering with the community makes sense and will serve families well. He said that it would sometimes make sense to deliver the program through a licensed childcare provider to improve access. The department will be seeking a partnership with a licensed childcare provider to deliver pre-primary as a pilot project in Kings County. Mr. Speaker, my question for the Minister is, can the Minister explain the requirements that a licensed childcare provider will need to deliver pre-primary in Kings County?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. And I'm thrilled that the Conservative Party, who voted against the pre-primary program, is now interested in this program. I think they've seen the light and importance and impact that this program can have on our children. We do have as a priority for this program to be in schools, because we know that helps with the transition into the academic learning environment. When it is not possible because of space issues, we are looking at partnerships with the regulated child care sector. In those cases, Mr. Speaker, the child care sector will have to follow the provincial curriculum and plan to ensure that we have a safe, healthy pre-primary program that's going to deliver good, quality, play-based education to our kids.
The honourable member for Kings North.
Mr. Speaker, I'd like to thank the Minister for that answer. Mr. Speaker, the people of Kentville and area want to know they're going to be treated the same as other areas. Licensed childcare providers need to understand the requirements so they can determine if they are eligible to partner with the Department of Education and Early Childhood Development. Licensed childcare providers also need to know the level of qualifications required of the needed employees to provide the services required. My question, when will licensed child care providers in Kings County area know what is required so they can determine if they are interested in providing this new service or can even find qualified staff?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. In fact, this form of partnership was a strong theme in the consultation that we had with the regulated child care sector. The sector told us they did want to partner in this regard, and I will inform the member that as recently as last week or the week before, our staff from Education and Early Childhood Development were actually in the area discussing this very issue with members of that sector, and I look forward to a prosperous partnership there and perhaps in other parts of the province as well, where space is an issue for pre-primary delivery.
The honourable member for Victoria the Lakes.
Thank you, Mr. Speaker. Mr. Speaker, my question through you is to the Minister of Business. Mr. Speaker, in today's world, cell phones and cell phone service are commonplace, but not all residents have the opportunity to have service in their communities. In areas like North River and North Shore in Victoria County, there is very limited service or no service at all. During some construction work last summer, the residents were without landline service more than they had it. And in some cases, they had to travel up to 20 kilometres to get cell phone service. So my question to the Minister is, will his department provide funding to establish reliable cell service in these areas and others throughout Victoria County?
The Honourable Minister of Business.
Thank you, Mr. Speaker, and I thank the honourable member for the question. Knowing the business environment in his county and his constituency, certainly with the impact of tourism, that creates all kinds of economic opportunities for those who live there, and among other businesses, traditional industries, and the private sector with respect to natural resources, and all the things that happen. I understand the importance of that connectivity. Obviously, the broadband conversation, which is happening simultaneously, is part of how we support business, safety first, but of course business as well in terms of connectivity to the rest of the world in which they operate. But with respect to cell service, we're always looking at those opportunities. The hardware of towers and heavy infrastructure, the physical infrastructure required to increase that connectivity is clearly important. So if there's specifics, I'd be happy to talk to the member about it. But of course, the department's always looking at ways to expand connectivity for Nova Scotians.
The honourable member for Victoria the Lakes.
Thank you, Mr. Speaker, and I thank the minister for that response. In the areas that I've mentioned as examples, there are people on Lifeline service who cannot access it when they have no landline service. If an individual has to contact emergency services such as ambulance, police, and fire service, many would be unable to do so by cell phone in the areas. Many service providers will not install cell towers in rural areas because they see no return on their investment. So again, I ask the minister, what can be done to ensure that one of these providers installs cell towers in these areas to improve the safety of the community?
The Honourable Minister of Business.
Thank you, Mr. Speaker. And again, with the cell service and the connectivity, it is similar to the broadband. The dressed up word around it is market failure, but the easy explanation is that the investment that would be required to service the amount of people that would be in a particular area just doesn't add up for the investment versus the cost. So that becomes the challenge when a private sector market and a private sector enterprise isn't available to do that. Then it becomes incumbent on government to fill those gaps. So that's exactly, again, with the broadband conversation is similar to the cell service and the connectivity. So this becomes about the strategic location of towers, what we can do from a public purse perspective by way of investment to help those communities that need it the most. Safety and emergency services and emergency management is at the key of this. TIR by way of their radio system, but of course we can help on the business side with respect to drumming up support and certainly providing investment for the cell service. So we'll continue to look at that for sure. Thanks.
The honourable member for Halifax Needham.
Mr. Speaker, my question is for the Minister of Immigration. The Atlantic Immigration Pilot Project was launched a year ago to attract about 2,000 immigrants to the 4 Atlantic provinces. In 2017, Prince Edward Island filled its quota. New Brunswick reached about 3/4 of its target, but Nova Scotia found only about 25% of the workers needed to fill specific jobs, and I'll table that. Nova Scotia's share of the pilot was 792 slots last year, and the province attracted only 201 immigrants. Mr. Speaker, at a time when we all know how important immigration is to our economic future, can the minister explain why Nova Scotia is lagging behind PEI and New Brunswick when it comes to the Atlantic Immigration Pilot Program?
The Honourable Minister of Immigration.
Thank you very much, Mr. Speaker, and I thank my colleague for bringing the question to the floor. Indeed, immigration is an excellent opportunity for Nova Scotia, as it is for all Atlantic Canada, not only to increase our population, which we desperately need. We read every day in the newspapers that we need our population to increase, but it's also a way to really increase our economic growth, and it's a way to increase awareness of our social surroundings. I'm very pleased of our numbers. So Atlantic Immigration Pilot is a wonderful opportunity, one that we are working extremely hard in this province, and I'm very pleased of our numbers that we have received in this province through the pilot. We've actually done extremely well, and those numbers are not exactly accurate. So I'll answer you.
The honourable member for Halifax Needham.
Mr. Speaker, I think we have to take a serious look at why we weren't able to fill all the slots available. And I would suggest that one possible reason is that the list of designated employers under this program is not made public. When asked why, the Nova Scotia Office of Immigration said it doesn't want employers to be inundated with applications. Mr. Speaker, highly skilled international graduates who want to stay in Nova Scotia can't find out who is eligible to hire them. Mr. Speaker, will the minister agree to make the list of designated employers for the Atlantic Immigration Pilot Project available to the public?
The Honourable Minister of Immigration.
Thank you very much. This also gives me an opportunity to speak to you a little bit about the immigration pilot. I've been going across the province, speaking to many settlement partners, many community partners, many municipal, and so on. Our uptake in that for just this year alone, it's not even been 3 months, has been almost 200 people that have been designated. Add that to last year alone in 2017, we've had 1,652 permanent residents that have filled the spots. In 2 years alone in this province, we had 10,000, actually 9,998 permanent residents that gained citizenship in this province alone. That is more than the number of the town of Amherst alone. I'm very pleased of our numbers, and Nova Scotia is being used as an excellent example in immigration when we're talking not just in Canada but all over the world. Thank you.
The Honourable Leader of the Official Opposition.
Thank you very much, Mr. Speaker. My question is for the Minister of Transportation, and this is a subject that I've been speaking about for, well, over 4 years in this House. And the town of New Glasgow is an age-friendly designated community. They are keenly invested in providing opportunities to promote healthy and active aging and living. Part of their strategy is to build and maintain a network of sidewalks and trails to get people out of their cars whenever possible. And we all know that boundaries between municipal and provincial jurisdictions are a discussion that matter to us in this House. So my question for the Minister is, how much funding is actually available in this new budget for sidewalk construction and maintenance?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and I appreciate the matter being brought forward, because in the department, our relationship with the municipalities across Nova Scotia at all levels is extremely important, and one that I think represents opportunity for both the municipalities and the department and the people of Nova Scotia to improve that relationship and to provide better services for our people. And the member is absolutely right. There is a significant responsibility difference between particularly the town municipalities in Nova Scotia and the department, and most succinctly I could say that civic matters such as sewer, water and sidewalks are the responsibility of the local municipality. However, saying that in areas where the provincial government has responsibility with inside these towns and inside these municipalities, we're always approachable to work with these municipalities to improve things for our citizens.
The Honourable Leader of the Official Opposition.
So, Mr. Speaker, basically when I started the discussion about 4 years ago was that the sidewalk was part of municipal responsibility. They did their part, we didn't do our part. So along the Westville Road, the town of New Glasgow has completed a sidewalk project up to the provincial boundary. At the boundary, the sidewalk ends, creating a dangerous situation. Westville Road actually leads to the Pictou County Wellness Centre, a destination for active seniors, children, and many traveling youth sports and teams. So New Glasgow and Pictou West is hoping that the department will complete the sidewalk network to get people safely to the wellness centre. So I'd like to know if the minister is going to help me after 4 years to finalize the sidewalk construction along the Westville Road, which is a provincial jurisdiction.
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and I really appreciate that matter being brought forward here at this time. And of course, we will work with this member and any other member that has matters around highway. And when it comes to sidewalks, of course, that involves safety. So this matter has not come to my attention before. I don't know if the local jurisdiction has contacted the department to put this on the table. I haven't seen it yet, but I'd undertake to investigate that, and we'll certainly take a look at it. Thank you.
The Honourable Member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Education. Many of my constituents who have children at the Wickwire Academy, which is the elementary school in Liverpool, are very concerned with classroom conditions. Standard custodial coverage at Wickwire consists of 2 8-hour positions and 1 5-hour position. Recently, coverage was reduced to 1 8-hour and 1 5-hour and 1 2-hour position. Mr. Speaker, this is a reduction of 6 custodial hours overall. No matter how hard custodial staff work, it is impossible for them to keep the classroom environment clean in this amount of time. My question to the Minister is, does the Minister of Education know why custodial hours were reduced at Wickwire Academy?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. That is a local operational decision that is made at the management. It's not even made at the board level. It's made at the management level. So the question is why. Yeah, those decisions, to be clear, are not voted on by the elected boards. As the members opposite would suggest, these decisions are actually made operationally by those who are in charge of the operations of the education system, Mr. Speaker. Just to be clear. So that is something that if there is an issue there, we can look into, but I do want the member to know that we do have full belief and trust in those managers and those leaders in our system to make the right decisions on behalf of our kids.
The honourable member for Queens Shelburne.
Mr. Speaker, this 6-hour reduction in custodial time may sound inconsequential to the minister, but in fact, we know that it's having very detrimental effects on classroom conditions and student health. With desks only being wiped down once a week, contagious illnesses have significantly increased among students. Reports of pink eye, impetigo, strep throat, scarlet fever are up at Wickwire. In fact, one primary class, 50% of that class has pink eye. One of my Liverpool constituents is so fed up with his children being subjected to these conditions that he's prepared to keep his children at home for the balance of the school year, simply to maintain their health. My question to the minister is, with his newly invested administrative powers, is the minister prepared to enforce the restoration of custodial hours at Wickwire Academy?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. Of course, health and safety of our students is paramount in every single decision that needs to be made in the system. If there is a health and safety concern in relation to this specific school, I'm very happy to take that information and ensure that we do a proper investigation at the department and regional level. Thank you.
The Honourable Member for Dartmouth East.
Mr. Speaker, my question is for the Minister of Health. Mr. Speaker, there is no one in this House, well, on this side of the floor at least, who will deny that our healthcare system is in crisis. With 100,000 Nova Scotians without a family doctor, it is time for us to get creative in solutions to provide Nova Scotians with primary care. As per a meeting with local pharmacists and a CBC article that I will table, there are many trained, accredited pharmacists and physiotherapists and other healthcare providers who could be providing services to Nova Scotians. My question to the minister is this: why won't the minister and this government use more trained, qualified healthcare providers to fill gaps in our healthcare system?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for raising this question today. It provides an opportunity to advise the member and all members of the House that indeed we are working with all healthcare professionals. In fact, that's a principal component of our initiatives around collaborative healthcare teams, Mr. Speaker. That exactly is what we're doing, is tapping into the full scope of practice of healthcare providers to work with our family physicians, Mr. Speaker, to ensure Nova Scotians get the primary care that they need when they need it.
The Honourable Member for Dartmouth East.
Thank you, Mr. Speaker. Well, certainly my conversation with pharmacists and physiotherapists differ. Pharmacists and physiotherapists are trained experts capable of doing important work in our healthcare system. One local pharmacist told me that legislation is already in place and that it's a matter of flicking a switch to enable them to do more to fill primary care gaps. We need more outside-the-box thinking and innovation from our healthcare leadership to actually make progress in fixing the crisis. Why isn't this government utilizing the resources we already have to turn around the healthcare crisis? Thank you, Mr. Speaker.
Honourable Minister of Health.
Thank you, Mr. Speaker. Again, in short, I'd like to advise the member to a specific question. The fact is we are making use of the resources we have to provide care to Nova Scotians. Specifically, as the member references, physiotherapists and pharmacists as healthcare partners providing care and having a scope of practice that can support. Pleased to advise the member and others in the legislature that, in fact, I've had conversations and meetings with representatives, Mr. Speaker, and I believe my next meeting is scheduled for, I believe, April 6th with the Pharmacy Association of Nova Scotia. We'll continue those discussions to find out where the opportunities are for us to do even more, making use of their skills. But I want to thank pharmacists and the Pharmacy Association of Nova Scotia for their help with programs like the Bloom program, providing supports around mental health in the communities. Mr. Speaker, have they stepped up to the plate to work with us to roll out naloxone kits to our communities to help address the opioid crisis, saving lives in this province, Mr. Speaker? So we recognize and we are working with those pharmacists in Nova Scotia, as well as all healthcare professionals.
The Honourable Member for Dartmouth North.
Mr. Speaker, my question is for the Minister of Community Services. The ESIA Policy 8.1.3 states that where a recipient receives less ESIA than they are eligible to receive through no fault of their own, the underpayment will be calculated for the most recent 6 months for which the lesser amount was paid. The Department's clawing back of child support payments has resulted in many families receiving less ESIA than they should have been eligible to receive through no fault of their own. Mr. Speaker, will the Minister agree to make the change to end the child support clawback retroactive in keeping with the Department's policy on underpayments?
The Honourable Minister of Community Services.
I want to thank the Honourable Member, and I want to share with this House how really excited I am that we've been able to make this change, Mr. Speaker, on a go-forward basis. And I would note, Mr. Speaker, that if that party thought it was the wrong thing to do, they had 4.5 years to make that change, and they didn't do it.
The Honourable Member for Dartmouth North.
Oh, that's it, sorry. Mr. Speaker, I was frustrated earlier this week to hear the Minister insist that ESIA recipients would have to wait until August before the Department would stop clawing back their child support payments. The Minister said it would take time to work through the process and train people. Mr. Speaker, this should be a simple change. The Department repeatedly charges people on income assistance thousands of dollars for overpayments. So will the Minister explain why it is apparently easy for the Department to take money away, but so extremely difficult for them to figure out how to give it back?
The Honourable Minister of Community Services.
I want to thank the Honourable Member, and I want to assure her that we're looking forward to seeing this change come into effect in August. We think that it'll have a significant effect on families. The average maintenance enforcement payment in the province is $275 per month, and Mr. Speaker, we're delighted that we will be able to offer that to the families who receive ESIA. Thank you.
The Honourable Member for Inverness.
Mr. Speaker, a question for the Minister of Health. In December, Antigonish-based ophthalmologist Dr. Hamilton was informed nursing support for his clinic in Cheticamp would be reduced, limiting the number of people he could see on each visit. Mr. Speaker, it's a long way from here to Cheticamp. It's a long way from Antigonish to Cheticamp. This eye clinic had provided service for 30 years, and as a bonus, Dr. Hamilton speaks French for the benefit of the local population. Good luck finding a replacement for Dr. Hamilton, given the shortages in specialists across our healthcare system. Why was a decision made to put a service at risk that has worked so well for over 30 years?
The Honourable Minister of Health.
Monsieur le Président, je suis remercié de la députée d'en face de sa question. Je suis heureux de vous informer que je me suis renseigné sur le statut de cette clinique au début de la nouvelle année et que la Régie de la Santé de la Nouvelle-Écosse m'a assuré que la dotation en personnel pour soutenir cette clinique était maintenue. Je tiens à remercier le Dr Hamilton pour son dévouement envers ses patients et de la région. Je vous remercie.
The Honourable Member for Inverness.
Mr. Speaker, the Minister is testing my comprehension of French. It's actually not bad. If I was fluent in Gaelic, I would gladly do it. And that's something the government needs to help us out in Nova Scotia so people can stand up here and speak fluently in Gaelic. Mr. Speaker, to me, this decision was an example of government making a decision to make it unattractive for doctors to practice in the province. Now, the Minister has said, and I think he's talked about in the new year, there was some efforts made to correct this issue. I was trying to listen intently there. Will the Minister go back and ensure that Dr. Hamilton has all he needs to continue these clinics with the same efficiency he has done with in the past? And will he send a message to the leadership of the healthcare system to make decisions that help those who are out providing healthcare? Putting eye clinics in rural areas at risk shows bad judgment.
The Honourable Minister of Health.
Thank you, Mr. Speaker. And yes, as I attempted to articulate there in French, recognizing, of course, the linguistic and cultural circumstances of the community in question, as well as was mentioned, Dr. Hamilton's ability to speak French in the community. I did reach out to the Health Authority when this issue came to my attention, and when I did so in the new year, they did inform me that they had reviewed the situation. Despite there was some consideration of such changes, that they did commit to making sure that the staffing complement needed to support Dr. Hamilton and his clinic for the eye patients in that region would be maintained.
The honourable member for Sackville-Beaverbank.
Yeah, thank you very much, Mr. Speaker. My question today is for the Minister of Finance. It's estimated that video lottery terminals put 6 to 8% of players at risk for moderate gambling problems and 1.5% of players at risk to develop a severe problem, which could devastate them financially. To help address this problem, in 2001, the Atlantic Lottery induced a number of responsible gambling features to all video terminals. These included a permanent on-screen clock that pops up reminding players of the length of play. Mr. Speaker, our office has received a call from a person who works at a local establishment, and they believe that the pop-up reminder feature, which is supposed to remind players at 60, 90, and 120 intervals of the length of time, seems to be somewhat inconsistent. Is the Minister aware of any other problems with this gambling feature?
The Honourable Minister of Finance.
Thank you, Mr. Speaker. Thank you to the member opposite. I do want to refer all of us to the Nova Scotia gaming strategy. That strategy, which guides, it's a guide for all governments. It was introduced by the PCs when they were in power. It was updated by the NDP when they were in power. We continue to follow that gaming strategy. It's designed, Mr. Speaker, to make sure that we have our players in a safe, responsible environment, and that we want to make sure that there is no undue risk for those who are playing on those games. If there's a specific question, I would be glad to seek the answer to that, but I do want all people to know that we are continuing to follow that strategy. We believe it provides a safe environment.
The honourable member for Sackville-Beaverbank.
Yeah, thank you very much, Mr. Speaker. And I do recognize that there have been actually 2 responsible gaming strategies in our province's history, and both of them, as acknowledged, was brought in from members of this side of the House. In fact, I think my colleague in Pictou East actually pointed out during our last session that the issue is that the most recent gaming strategy actually expired in 2016, and I don't think there's been a newer strategy that's been presented yet. It's clearly a responsible gaming plan is vital to a sustainable gaming industry. So my question would be, would the Minister direct Atlantic Lotto to conduct an audit on the responsible gaming features on all video lottery terminals in Nova Scotia to ensure that they're operating properly?
The Honourable Minister of Finance.
Thank you, Mr. Speaker, and to the member's suggestion that there is no gaming strategy, I think I made it clear that we continue to follow the guide, which was the gaming strategy that was introduced as I went through the history of that. In 2011, there was reference to 2011 to 2016. That was in 5-year in the terms of reference. That did not change the strategy. We have not abandoned that strategy. We continue to follow that strategy. So I want everybody to know that we are operating within a gaming strategy.
The honourable member for Cumberland North.
Thank you, Mr. Speaker. Back in 2003, we had a new hospital built, the Cumberland Regional Healthcare Centre. But it was built just outside of the town limits. And during that time, the community was told that a sidewalk would be built between the town and on the other side of the highway where the new hospital was built. To this day, Mr. Speaker, nothing's ever been built. So we have people walking every day in unsafe conditions because there is no sidewalk. And also we have the elderly driving their electric wheelchairs on the highway. And we've been calling for this to be built now for about 15 years. And I'm wondering if the Minister of Transportation would be willing to work with myself and the local officials in the town of Amherst and county of Cumberland to come up with a solution.
The Honourable Minister of Transportation.
Yes, thank you, Mr. Speaker, and thank the member opposite for the question. As I mentioned earlier, the department is always welcomes the opportunity to work with our municipal partners. But to be clear, the responsibility for sidewalks in Nova Scotia is a municipal responsibility, and so therefore the County of Cumberland will be responsible for that. If there's any way that we can assist, we would be more than happy to work with them as we would in the municipality of the County of Pictou. Thank you.
The honourable member for Cumberland North.
Thank you, Mr. Speaker, and I thank the Minister for the question. And I realize that he has not been in that position as long as since the hospital's been built. But the county and the town have, in fact, tried working with with that department for several years and have been shut down because the sidewalk, the Trans-Canada Highway is right in the middle. So they've actually been working on solutions, both the town and the county, and have been shut down continuously by TIR. So I'm thinking maybe we could take some of the profits from the Cobequid Pass and help us build a safe walking trail from the town of Amherst to our regional hospital.
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and thank you, Member Opposite, for the question. I'm so happy to hear her concede that the Cobequid Pass has been an excellent investment for Nova Scotia, which may be creating profit. But I'd be more than happy to reopen that file and have a look and see what's going on. But at the end of the day, the primary consideration and the funding would have to come from the subject municipalities. Thank you.
The honourable member for Sackville-Cobequid.
Mr. Speaker, the government is failing Nova Scotians. And my question will prove it, Mr. Speaker.
Order, please. Time allotted for oral questions. The time allotted for oral questions put by members to ministers has expired. We'll now move on to government business. The